Thanks everyone for joining what is the second iteration of our Bitesize series. And today we're going to be having a number of really good talks for both senior and junior members of staff about securing funding. So please, it's kind of pertinent across the board. So first of all, the way it's going to work is we're going to have talks from Gwyneth Davies, Future Leaders Fellow in PPP and ICH, David Longs, the co-lead of the STEM cellular gene and STEM theme, and Thomas Wade, the director of the BRC. And then those three will give talks, and then afterwards we'll have a round table with Gabe Galea, Amy McTeague again. Sorry, I lost your name there. I was thrown by forgetting the theme name. Where we can ask questions. So Amy, sorry, Gwyneth, if you want to take it away. You can stop. You got ahead of talk. Sorry, take it away. Got to take it away. I know what's going on.
I'll actually start.
Sorry.
Can you hear me all right if I speak like that? I don't need a microphone.
No.
Okay. So I'll start with a pretty anti-climactic talk. Okay. What if I don't get the grant? Has anyone here ever had a grant rejected? So it does happen, okay? Does happen. And I thought to give it a bit of thought, how to go about it and what it might mean. And I just invite you to be pretty present, because that will allow you to better understand what I'm saying, while if you are doodling on your phone or doing something else, which is also very interesting, you will surely not get it. Okay, so when we are young, most of you are young, that's also why you're here, we have dreams of our life. We all hope we find the perfect soulmate really early in life. We will have wonderful families, perfect surroundings. And of course, we dream in the same way about our career, right? We will do our PhD about the theory of relativity. Then we go to work with Stephen Hawking on the attraction and acceleration on the edge of the black hole. Then we go to Carlo Rovelli to do our fellowship and calculate the super white hole, and then at the pinnacle of our career, we will modify the Einstein-Rosen equation of how to get from one universe to the metaverse. Okay, all fine, fantastic. But we all know chances are it may not play out exactly like that. And that's a bit what I want to talk about. So the truth is, most careers, and this is still an overall upward trajectory, most careers go somehow like this. And actually, as you are living more and you will be living more in the future than I am, but already in my time, the rules of the game and also the potentials of what we're doing in science have changed so dramatically that today, not only are there completely different options, but many of us have actually different professions to what we were thinking we might have when we did our studies, right? I still wrote my thesis on a typewriter. I mean, for most of you, this will not be imaginable, but it was like that. Actually, an Olivetti that could correct 11 signs was an advantage at the time. So why is this important? Because it means that over time, there's a significant risk or potential we have to reorient ourselves. And reorient may also mean that we might do something completely different or quite different from what we had thought at the beginning, or what we had set out to do. So on our path, we will have a number of grant applications if we stay in the academic world. And the red stars here are the successful ones and the black ones are the unsuccessful ones. So sometimes it goes up, sometimes it goes down. And then the green one is a completely different one that has nothing to do with all the previous ones. So that's not an unlikely scenario. And that brings us to the point, what can we take from these inflection points when suddenly something changes? So we submit a grant, we've put a lot of work into it, and then it comes back negative. Okay, what's happening? The usual reactions are denial, impossible. I wrote the best grant. How on earth could this not go through? Disappointment, you know, really, this is a letdown. I wanted this one. Anger, all the panel must be biased. You know, they have something else in mind, but it wasn't written, it wasn't in the layout. Frustration, why can't I get to the next thing? And self-doubt. Maybe I wasn't good enough for that one. Maybe I didn't get all my act together, or I didn't put enough work in. All of this. What I want to invite you in general is to just sit with this a little, because there's a lot of value in all these emotions, and you can use them. So just be aware of what's happening to yourself, not only in the surroundings, it's not only the panel. Just be a bit aware of what's happening to yourself. And sometimes the universe, or if you're more an existentialist, life, is trying to tell you something. It may also be telling you that you're not on the right path, or that you have to change tacks. It's only one of the potentials. So, how can you read this out, what life is trying to tell you? How can you read it out? So that's a key question in all of this. And there's this little sign here of the lady who has an internal compass. You all have this internal compass. We all have this internal compass, because we've come here to do something very specific, which is unique to each of us. So it's different for all of you as you're sitting here, but everyone has something he or she wants to accomplish. That's very, very individual. Now, we all live in an environment where we have academic mentors who will tell us something we should be going for because that's what they have in mind. Then we have family surroundings. They may be telling us the same or something different, and they may not be happy with what we're doing. And then we have peers who have their own opinions. And this is all very cognitive and is thrown at us. At the same time, on the other side, we have the grant-giving bodies, and you will hear more about Wellcome Trust, MRC, NIHR. They all have their own modes, they all have their own speak, they all have their own rules. And for whichever one is applying, one has to actually dive into those rules to really understand them well. Otherwise, the chances of being successful are low. But the basic orientation you can have in all of this is your inner self that will tell you what is the best way for you to go. And why this is important is that if you ask for something which is not in synchrony with yourself, it's very likely you will not get it. Absolutely important. Can't overstate this. And the academic world is quite treacherous in the sense that a lot of the grant opportunities actually encourage opportunistic behavior, because you really want to do this and go there. But there's a grant opportunity which is not exactly in that direction, but at an angle of 45 degrees to the left or to the right, where you could combine what you want to do in your molecular biology with some spatial transcriptomics readout. It's not exactly what you wanted to do, but there's money there. There's money there. And so this can be very tempting to go to the left or to the right. And we're always in that situation as we go along. Now be careful what you're doing and what you're asking for. And really think of what you want to do and where you want to go. So my grant has been refused. Just take a moment to sit and to think about it and let all the emotions be real. That's important. And then where do you go from there? Where do you go? Well, the really important thing, I think, is that you try to define your vision of the future. Your vision of the future. Not your mentor's vision, not somebody else's vision, your vision of the future. That will be different for all of us. And doing so, you need a couple, in order to be successful, a couple of ingredients in this soup. Resilience is a very important one. As everyone on this pathway can tell you, there are a couple of letdowns on the way, and people have different resilience. So this is why one has to be in contact with one's own self to really understand how much one can take. Some people are very resilient, right? 5 grant rejections, I write the 6th one. Others, after 2 or 3 in a row, get really depressed. So you have to know how much you can take. But certainly on this path, if you want to follow it, resilience is required. Enthusiasm. Why enthusiasm? Well, if you're in front of a panel where you have to defend your grant application and you're not enthusiastic about what you're doing, and you present it like drab homework, the next one who is enthusiastic will get it, and you won't. So be sure that you're enthusiastic about what you really want to do, that you're really genuinely interested. It's so, so, so important. Try to be original, because of course, in science, originality sets you apart from what many others are doing, and try to invest positive emotions. I put gratefulness here because we are all in a very privileged environment, and that certainly helps to develop an interesting career. But I could also have put love and compassion for many people who are also working in the clinic, for example. This is a big driver. They know their patients, they know the disease they have. They can feel on their skin what it means to have such a disease. That's a huge driver. Whatever your driver is, there doesn't need to be one specific driver, but try to bring it into your work and try to have positive emotions, because positive emotions are what makes your vision of the future fly. And then welcome change. Now, that's easily said, but we are usually not very good at that, okay? Because change induces fear. If suddenly our environment changes, also our professional environment, we lose our self-asserted stance very easily, where, we've learned all the method, we are somebody in the field, we feel we have something to say and we're secure, and suddenly we come into a very different environment, maybe where people even speak a different language, where we are just one amongst many who knows something, and where we have to find our standing again and our impact. So that can be very scary. How can you overcome this? Well, again, positive emotions. Courage is very important. You just need to be courageous to do something like that. Curiosity, flexibility, buy into new environments, try to learn from other people, because usually creation is co-creation. We never do it alone. We always do it with others. Try to buy into new environments. Try to gain new perspectives, not only on your surroundings, also on yourself, because you will be different if you are in a different environment. And that by itself is very enlightening. And then have joy, have fun, you know, enjoy the ride rather than being on the back foot all the time. That's it really, because I think our goal in life, and you know, writing grants is just one of the many steps in this, is to grow, to expand, and ultimately to co-create. None of us does anything by himself or alone. We are all taking the fruit of many, many others who have worked in that domain for many, many years. So we want to co-create and welcome all the challenges as they offer you opportunities. And a turned down grant application is an opportunity to understand something. I'll stop here.
Yeah, as I said, I think we'll keep the questions for the roundtable at the end and move on to the next one, which hopefully is well.
Good to go? Yeah. Thanks very much. Well, that's a hard act to follow. And actually, I'd encourage you to, as I'm talking, just reflect on some of the things that Thomas has said in his presentation, because there are some themes that really resonate with mine, and you'll see some drivers that have really driven me to, yes, follow that passion and that desire to have research be based on something that you're really driven by, but to have some key things that might cause those inflection points. And for me, those have been patient priorities and the sort of patient voice and the co-production and kind of working together in partnership to develop that. So a bit about me. I'm a clinical academic at ICH, so I'm based in PPP. I'm a clinical associate professor there, funded by UKRI, and I'm a consultant paediatrician in respiratory at Great Ormond Street Hospital. And here are the, I think probably the reason why I've been invited to speak today is because I've got a number of grants and fellowships to date. So these include quite small awards from in the tens of thousands to some personal fellowships, to two grants there that were over £1 million, one a clinical trial, an HTA trial, and the other one my Future Leaders Fellowship. But as we've already heard, with success comes a stream of failures as well. So here are some of the failures. So I was unsuccessful for 2 doctoral level fellowships back a long time ago now. I put the almost identical application in for my UKRI Future Leaders Fellowship to the NIHR Advanced Fellowship at almost the same time, well, pretty much the same time, very similar application, and it was not shortlisted, deemed not competitive. So that's just an example of how 2 very similar applications, depending on the panel and the remit of who's looking at your application, can really love something or really, really hate it. And it's not necessarily a personal reflection of what you've done. And I've had grant rejections both as a lead applicant and as a co-applicant on grants. So this is my fellowship. So Future Leaders Fellowships are often abbreviated to FLFs, but they are a program of fellowships by UKRI, and they incorporate all of the main research councils, and then it gets your application gets driven to whichever research council best fits yours. So for me, that was the MRC. And the Future Leaders Fellowship gives 4-year funding on a full-time basis, which is extended pro rata if you're part-time, as I am. And that gives you the commitment for that duration, but there's also this opportunity when you have that to apply for an apparently ring-fenced extra 3 years of funding at the end of that. You also, when you apply, have to have a commitment from your host institution to an open-ended post at the conclusion of the fellowship. So they're really attractive from that perspective. And I think as the rounds have gone on, that that has become a main driver really for one of the kind of things that differentiates this fellowship program from some of the others. And it's cross-discipline, they encourage multidisciplinary projects, and they're really broad in terms of the research that have been funded through FLFs. So my FLF is called Designing and Enabling Pragmatic Clinical Trials in Cystic Fibrosis to Simplify the Burden of Treatment. So how did I get there? Well, just a very brief background on cystic fibrosis. This is a multi-system condition. It mainly affects the lungs and the digestive system, and it's a life-shortening condition. But over recent decades, with improvements in supportive treatments and improvements in standards of care, there's been an incremental increase in survival. And on the right-hand side here, you can see on the y-axis the median predicted survival in age. And we start here in the 90s. And you can see over decades that there's a kind of incremental increase in life expectancy, but you can also see the shape of that graph, that over the past few years, there's been a change in the slope of that. And that reflects that we now have transformational therapies in cystic fibrosis that are really altering the clinical outcomes very rapidly. And you can see these changing clinical outcomes in terms of survival or improvements in lung function reflected on large databases. And in cystic fibrosis, we're really lucky to have really good disease registries. In the UK, the Cystic Fibrosis Registry covers more than 99% of our CF population, and that's by far the best on a worldwide basis in terms of population coverage. And we collect at least annually quite detailed information on people with cystic fibrosis in the UK. And that information that we get from those registries is used for a whole different array of different research projects, from observational studies. It's used by NICE for health technology appraisals, pharmacovigilance studies, and over recent years, it's also started hosting pragmatic clinical trials. And within the registry, during my clinical lectureship funded by NIHR, I was interested in trajectories and personal trajectories of people with cystic fibrosis and what the kind of key drivers were that influence disease course. But because we have quite detailed information on treatments as well, you could really appreciate that treatment burden and the number of treatments that people with CF were on. And this brings in the patient perspectives and what are the patient priorities for cystic fibrosis. And the James Lind Alliance is an organization which aims to host priority setting exercises, which then makes the funders aware of the issues which matter to people with the condition or the disease or the question under being investigated. And that the priority setting partnerships that the James Lind Alliance support are a collaboration between the lay community and the professional community. And then they aim to deliver some top priority questions in that area. And in cystic fibrosis, this was done a couple of years ago now. And the top priority for clinical research in CF was what are the effective ways of simplifying the treatment burden of people with CF. And I said to you about those transforming clinical outcomes and those incremental changes that we've seen as a result of standard care, but that those are now improving quite rapidly. And what's happened is these new treatments have been introduced on top of a whole host of other treatments that take on average a couple of hours every day. So people who are on 10 treatments take a couple of hours every day, and people are getting fed up with the fact that everything just gets added and added and added. So I was interested in combining my interest in the registries, this priority of how we can reduce treatment burden, how we can harness data within registries and using electronic health records to investigate that in pragmatic clinical trials. And that really forms the basis of where my fellowship came from and where it is going. But in parallel with this, because it's a rapidly moving field, the kind of time of when we wanted to do this in a big clinical trial was happening around about the same time I was applying for my clinical, my fellowship. So that we put an application into the NIHR Health Technology Appraisal Programme to do a randomised registry clinical trial, really focusing on that. So could we do a trial that was really driven by those patient priorities? And we had a lot of engagement from the cystic fibrosis community to understand what they might want from a trial. And they wanted one that was fitted in with their clinical care, no extra trial visits, that focused on therapies that they felt really burdensome, such as their nebulized therapies. And that they could use this to make some decisions about what to do with all of these treatments that are taking so much time on a daily basis. So this trial is funded by the NIHR HTA, as I said, and we use the registry to host that trial. We randomize people on the registry, we collect all our outcomes on it. We also developed systems, which also links into my fellowship, of how we can capture directly patient-reported outcomes on that. and incorporated a process of electronic consent so that this trial could actually be delivered fully remotely if it was needed. So that's a little bit about sort of my my grants and my fellowship to date. And what I thought I'd do now is just have a couple of slides on top tips for research grants. And as we've already heard, it's really important to have that passion and belief in that the research question is important, and it's not just you that thinks it's important, that you get buy-in and support from others to think that you agree with that question. If you're going for grants, think about who will be the lead applicant for the NIHR clinical trial that we got funded. I'm a joint lead applicant on that, and I'd really encourage you to think about the joint lead applicant side of things. It's a really nice way, if you haven't previously been a chief investigator on clinical trials, to go in there with somebody who is more experienced. So the lead applicant for that clinical trial is a professor in Alderhay, and we've worked really nicely with each other because we're quite different. We bring different things to the table, and it's a great learning experience for me, and he apparently enjoys working with me in this sort of joint role. It's really important to build those collaborations early, but also when you're writing these grants, to choose your co-applicants carefully. It's always going to be the case that even if you've got a huge team of people, the bulk of the work is going to fall just to 1 or 2 people. But everybody on that grant needs to have a dedicated thing that they're going to deliver and be responsible for delivering. And don't just put names on a grant because it looks good or anything. Think really carefully about who you're going to have on there. For any research grants, and this applies to anything that you're going for, just read the guidance notes because they're full of really useful information. And find out what actually they can cover really early on so that you don't get quite far down the line and then realise it's not appropriate. Listen to feedback, look really widely for opportunities, and it's okay to be the first person in your institution to go for things. It does sometimes take a bit longer if that is the case. So for example, I went for an NIHR Clinical Trials Fellowship. They've now been rebranded, but when I did that, I was the first person in UCL to do that, and it takes even longer than usual to go through the contracts process if you're the first one having a specific type of contract in your institution. Similarly, I was the first one in ICH to have a Future Leaders Fellowship, so it always takes a little bit longer, but it's okay to be first, and it's sometimes a positive thing. And consider the benefits of submitting 2 very similar applications to different funding streams versus waiting. And sometimes it's right to put a couple of things in at the same time because of your own personal timelines, but sometimes it's better to have some feedback and then go for the next one. So there's no sort of right answer on that. It has to be a kind of personalized approach. And then for the fellowships, you'll all have heard of the 3 Ps that are really critical: person, project, place. I didn't get the MRC and the Welcome doctoral fellowships that I mentioned mainly because of the project, and it was absolutely right that I didn't get those at the time because I hadn't really had any experience of gathering the kind of pilot data that the funding panels wanted to see that I had gathered before putting the project proposal in. And I think now that people now have better opportunities to do that as clinicians in training, to have protected time for research than you may have done when I was coming through this period. We've already heard about the importance of finding a good mentor. That's really important. You can never start too early with thinking about fellowships, even if it's just a kind of in the sky idea. Talk to others, read applications that have been funded, and if you can find someone that's willing to share it, those that haven't been funded is really useful to share as well. And use available resources. It's quite amazing how much you can actually find if you go looking online. For example, for UK RI Future Leaders Fellowships, you can get a list of the interview, the potential topics and questions that come up at previous interviews. You can get quite a lot of pointers really that can help steer both the sorts of things that the panel might be really wanting to see in your application, and when you come to interview, how you might be tackling those. Pre and post funding, when you're thinking about fellowships, is really important for those bridges, particularly when you might have had life events that might meant you've had a break, or that you might have come to a period of funding and you just haven't had enough time to get quite there for applying for that. So from the BRC or from MRC or Welcome, I had an institutional support fund funded by Welcome with UCL, which was hugely helpful as one of these bridges, which without it, I think you lose that opportunity for ongoing momentum with research as you're going through. And it's also okay to be less than full time. I was really shocked about with my UKRI Future Leaders Fellowships, there's hardly any of us are working on a less than full-time basis, which is really, really surprising, but it's okay, you can do it. And even if you split your time in different ways, it's okay. And just to show how long things take a long time. And this is why I said to start early, because this is my application timeline with the Future Leaders Fellowship from that initial expression of interest within the Institute coming out in summer 2019, right through to the different processes and the hurdles within that. And then I started my Future Leaders Fellowship in 2021, and it does take some time. So that's why thinking about this funding of those bridges and gaps and thinking early is really critical. And then nearly at the end of my slides, then I just wanted to mention about peer review, because I think it's difficult to underestimate the value that it is from getting feedback from different people. So don't be afraid of it is the first thing to say. Internal peer review prior to grant submission, you might have some formal opportunities or informal opportunities already within your department to do that. For example, in PPP, we have a chalkboard session where anybody going for grant applications or fellowship applications has to present at a departmental chalkboard session whereby you have feedback from colleagues in your department, and they're incredibly helpful to guide your application. Peer review should be constructive. It absolutely doesn't always feel like that. It can sometimes feel really brutal, but it's that's where some of this resilience comes in, and just often the points that are made are very good. You just have to handle them in such a way that you can move forward, get more than one opinion, and also contribute to peer review yourself, because that's a really useful point in terms of thinking about grants or fellowships. Reading other people's grants in a totally different topic area is quite useful to see how people frame things for your own learning. So finally, be prepared for bumps in the road. I've had plenty. Persevere. Things don't always go to plan. It's not necessarily a bad thing. And the journey is only just starting when funding is awarded. Thank you very much.
Like the last one, on the round table.
Okay.
I'll go ahead.
Right. So yes, I'm going to give a slightly different talk to the two that we've heard so far, although some of the things topics are very similar. So really, I decided to give you 10 simple tips to writing a good grant application. What's going on there? What's that one?
So onto it again. And again. Yeah.
Okay.
Down is next.
All right, I'm going back now. Okay. So yes, I'm going to give you 10 simple tips. A bit of a disclaimer. I can't promise that your grant will be successful if you follow these tips, but I think you might have a better chance of success. So what are my credentials for giving this talk, really? So as Thomas mentioned, I've had a very long different grant journey, which is very circular, not a very straightforward trajectory, but I've got about 15 years of applications from early career when I was much younger and had much more energy, to now the more leading consortium proposals. And overall, I've had about 40 successful applications for PI, but I've had many more that have been unsuccessful. So I was opening one of my folders today, which had my grant applications in, and I have probably about over 120 unsuccessful applications there. I've had some fellowship success throughout my career, so I currently have a Wellcome Trust Investigator Award. I was MRC New Investigator Award, and also I had a Kidney Research UK Fellowship. I'm also a reviewer for multiple funders, and I've been a panel member on various committees for Kidney Research UK, where I was on the panel for fellowships and grants, the MRC, and also I've been involved in the reviewing BRC applications. I've also mentored quite a few people in our laboratory. One is in the audience here, and they've gone on to get their own fellowships and also get their first grants. So my first tip is really to, and we've heard this already, is really to know the funder that you're applying for. And this just shows, this is just an example in our department in developmental biology and cancer of the all different funders that we have. And there's so many, and they all have their own different credentials, and they have all their own different processes. So really, you need to really research this quite substantially before you go in with an application. So think about what is their remit. Is it focused on basic science, like the BBSRC? Are they more translational, like the Great Ormond Street Charity? Or are they focused on clinical? Do they have a disease focus? And it's really important that you look into this and see where your grant fits. I also always look at the success rate. So some of these success rates for these funders are like 1%, and it's like, really, is it worth the time and effort to put in to put that application in for that funder? So it's worth looking at these things, and also how tedious the process is. So some of them have three settings, you might have to do an outline application, then another outline, and then finally you get to the final thing. And so how much effort is really involved? So there's all different things, and each funder has their different nuances, really. It's good to talk to the funder directly. So they're very keen on this. So they always want to reach out and talk to you if you want to apply. And this is actually a very good idea. And also discuss with previous applicants. They're the best people who know what the experience is like of applying for a particular funder. Okay, this is the worst part of writing a grant, which is the other, not really the science. It's the other things that you have to do to actually get an application in. And these are the administrative parts, which actually, until you start writing a grant, you actually don't know that you have to do these things. And it's getting things like costing for your staff, equipment quotes, knowing facility charges. All of these things are required when you write a grant. And collaboration letters, ethics, and supporting letters, particularly for fellowships. And it's really important that you really identify what these administrative tasks are very early on. It's really the most stressful part of the application. And so get advice, talk to people who have done it before, and really, as Gwyneth said, really start early on, because some of these things can take absolutely ages to do. As you can see, this person is going through a lot of pain here with this stuff.
Don't leave it to the last.
No, otherwise it won't get submitted. Okay, so the third tip that I have is really to target your audience. And this has changed actually over the last, I guess, 5 years. It's different from when I started writing grants. And actually, you now need to target your grant to a much broader audience. It's going to be read by many different people. It will be read by reviewers who will be potentially an expert in the field, the broader panel who have some interest in science but won't know your field at all, and also patients. So now more funding bodies have got the patients involved in their funding process, and so you need to be able to appeal to all of these people when you're writing something. And my best advice is to keep it very, very simple, and to really be able to explain your vision very concisely and to someone who's reading a newspaper or reading the London Metro. And so really to be able to understand your idea very, very easily. Also, really, it's going to be a non-expert panel. And one real problem with, particularly with early career research grants, I find, is that you've got to assume that the reader doesn't know your work at all. So some people write and they say, okay, as you've seen in my previous work, and there's no time for everybody to read your previous papers. So all the information needs to be in that form that you're writing. And in my lab, we have the 15-minute train test. So when someone writes a grant, they give it to me and I try and read it on my journey home from Liverpool Street into Essex. And if it's any good, I can read it and understand in 15 minutes. And when people start, it sometimes takes 15 hours for me to understand what they want to try and do. But if the application can pass this 15-minute test, it's probably pretty good. Will, some of your applications now pass the 15-minute test, but they didn't used to. Oops, I'm stuck. Okay, so we're on to number 4. So this is what the real simple things that you need to include, and this applies to any possible proposal that you have. So as I've mentioned before, it's important to really keep things simple and to really get across the importance of the research that you want to do in the first paragraph, in the first few lines, to really encourage someone to read on. So you've got to be aware that the reviewers or the panel may be reading 20 of these things. And if your first paragraph is boring and not very interesting, they won't be encouraged to read on. State the impact of the work that you have on either on healthcare or economies or in society. This is really important to get across. You will need to get across a very clear rationale for doing the work, have a very simple aims and hypothesis. And really writing a grant is a selling process. You've got to be a salesperson. So you need to get across to those people why this is the best thing since sliced bread. Why is it so exciting and why do you want to do it? And think of the person who's reading it. So many grants I get to look at, it's clearly that the person has not read the text back to themselves or read it out. And if you do this, you get a really good idea of how your grant flows and whether it's interesting for someone to do. Okay, and the main thing is actually you need to do some practicing to develop your own style. So in our group, I get people to write early, very small grants for £5,000 or £6,000. Those opportunities that we've had for the BRC to get your style and really get an idea of how to do writing and get your practice. Right, so this is another area where grants fall down. It's really convincing the reader that you can actually do it. And really, I think there are some very simple things that you can really follow to really make sure that you can convince the reader that you can actually do the piece of work. And I guess this is really the minimum that you can do is you can look at the cited literature, and you can try and convince someone that people have used this sort of idea in the past or these methods in the past. Gradually, as you increase your chances, you can do this by highlighting your track record in the field, having a clear experimental plan. But really the best grants always have quite a lot of preliminary data. Essentially, you may have done virtually the experiment already that you're applying for, and so there's no risk. Funders don't want risks, so, or very limited amount of risk. So the amount of preliminary data that you have is very important. And this is important in terms of the timing of when you apply. So you've always got to think, do I have enough preliminary data to be applying? Have I got the strongest case possible? Funders are very keen on having a statistical plan, but most funders are assessed with power calculations. Even if you're doing very small on cell culture or things like that, they want to see that you've got a plan to analyse the data. And also having a realistic timeline with milestones, really thinking of what will you achieve within the period of that grant. Okay, I think this is a bit of a controversial slide because when I was writing grants, I wasn't told this. So I think it's actually quite important to actually show that you're flexible in your plans. And so this I think originally was seen as perhaps weakness, really, that perhaps your hypothesis was not going to be correct, and that if you had, and you were thinking that actually things may go wrong. But actually, I think now I've come to the conclusion that it's very important to show that you're very flexible in your plans. So you can, in your grant, you should define your expected outcomes, but you should identify what the risks and what things might go wrong and have potentially alternative plans. And funders like this quite a lot. And it's really showing that you've got flexibility in your understanding that the direction of the project may change as you go along. Virtually every grant I've wrote, we've never done what we've said in the grant originally. It's always, the plans have always changed when we started doing the experiments. Okay, this has been talked about before, but it's important to make time to get feedback. So there are various ways of doing this. Gwyneth has mentioned the departmental chalkboard. We have this in our department as well. Peer and patient groups, particularly getting feedback from patients is important. Is it a research area which the patients think is a priority? Ask your mentors and have interview practice if you're going for a fellowship. I have to say that these things are really help. I had an interview with 3 senior members at ICH. It was the worst half an hour ever going through, and they just tore the proposal apart. But actually, when I then went on and did the proper interview, it was a lot easier. Okay, and now when you write a grant, you often get a chance to actually rebut. So you'll get reviewers' comments, and they come back to you, and you'll get a chance to rebut them. And this is actually a very important part of the process, and it's not done very well in many applications. And actually, I think sometimes it can be the difference between getting the grant and not, particularly if what normally happens on panels is you have 2 grants which are fantastic, the rest are not great. There's a lot in the middle. And actually having a good rebuttal can actually push you over the line and actually get your thing funded. And I get a lot of, when I'm on the panels, a lot of angry rebuttals, attacking reviewers who are not very happy with what people have said. But actually, it's a really important opportunity first to clarify any queries that they've got, but also really have a calm and considered response. It's like the reviewers who have said the comments will never see this. It's like it doesn't go back to them. It's just the panel themselves. And so if you come back with a very angry response, you just alienate the panel. So, and I've learned to not waste any time in the rebuttal and the positive comments. I used to spend a lot of time saying, oh yes, it was fantastic that the reviewers thought this, and I've now concluded this is a waste of time. And so it's just best to focus on any critique that you have and really focus on addressing this. It's also an opportunity to add any more data. So if you've got more preliminary data, this is a good chance to add this in. And I always try and turn the negative things into positives, and so have a very positive rebuttal. So if someone has said something negative about a grant, I'd say, okay, well, that's a great point, but we are doing this. In turn, turns into a positive point. And we're nearly there. Okay, this is what we talked about this a lot already, but you've got to be prepared to fail and develop a thick skin. As I said, it's like I've had over 100 grants which have been unsuccessful, and you get lots of resilience through this. This is my career trajectory right at the start of my career. This was essentially, this is a side of failure. I had about 6 or 7 fellowships applications that were unsuccessful. Gradually, I got better writing and also took some of the feedback on board. And eventually, I haven't even put it on the side, but eventually I was successful. So, but there's a lot of failure that you do need to go through. And this is the same in most people's careers. And Thomas, I think, has mentioned it. You must have got these things on the same website I got. But these are sort of the stages that you go through when a grant is. So I'm not going to bother going through this. But my advice is to just be persistent and remain very positive and believe in your work. And use the comments to refine your proposal. It's like some of the comments may not be great at the time and they may feel very personal, but actually you can use them to improve your grant. And my last slide is really, you might do all of these things, but there's a lot of luck involved in getting a grant still. And the older I get and the more that I put in, I think that this is a significant proportion of you've got to have everything that falls in place. You've got to have good reviewers, you've got to have a nice panel. And so you need to be a bit lucky. And sometimes that doesn't work. The reason that you may not get a grant is just that you've fallen outside the threshold. Maybe the panel member who's presented your grant may not be enthusiastic on the day. And there's a lot of luck to it, I'm afraid. That's it.
Thanks very much, David. So we're going to have a round table of all the people who can ask any questions. Do you want to take to a little bit of the front? Maybe if we start off, could Amy, could maybe if we start at the end, Gabe, do you want to just do a quick introduction? Amy and Polly.
Sure. Right. Hi, I'm Gabe. I'm a okay. What am I? I'm a principal research fellow in the BBC, and I'm a Welcome Stage 2 clinical research career development fellow. Ignore the clinical word there. I'm a fundamental biologist.
Hi everyone, I'm Amy. I'm a clinician scientist here in ZCR, got a research group, Jenny from my group is there. And I'm a paediatric neurologist at Great Ormond Street, so I'm a clinician scientist. And so I had an MRC PhD funded after many failures, and then an MRC clinician scientist fellowship. And a bit like Gwyneth, I submitted the same proposal to Wellcome and to NIHR and was not even shortlisted for either of them. In the same week, I then finally got an interview for the MRC, which was a bit of a big few moment. But prior to that, I was looking to get the BRC pass list, which supported me with my proposals. So yeah, that's me.
Hi everyone, I'm a paediatric nurse in the Trust at Great Ormond Street. I was the first nurse in the Trust to have an NIHR PhD fellowship. And I've recently been awarded an advanced clinical academic fellowship with the NIHR. So I'm the first nurse in the UK and the only nurse. They only gave 4 this round.
This is really an opportunity to ask any questions based on the talks or any other questions that may not have been addressed that you might have. I think there's a few questions online perhaps, but do we want to start in the room if anyone has any questions?
I'm writing a fellowship at the moment, and one of the things I'm struggling with is working through the aims I want to do, because my third aim is I don't have pilot data for it. It's a very new area of research that I want to move into. So how do you broach that? Obviously, I've got collaborators and supporters that are in that area, but I don't really know how to approach it in terms of proving that I can do it.
I mean, I think you've mentioned already some of so it's about the kind of deliverability of your proposal. So the reviewers are going to look at that and say, can she do it? So you've already mentioned that you've got collaborators who work in the area. So they may be having them mention specifically in their letters of support that they are happy to support you with these, learning these techniques or whatever it is you're going to do, so that people are reassured that you'll be able to do it. And if you can link those techniques to another technique that you're good at already and show that it's just a development of your skills rather than a completely new skill set. But then I'd also turn it into a positive and say part of the fellowship is about you developing as a scientist and becoming independent. And you need to show that you're going to develop this new skill that then is going to allow you to develop your research niche. So you can kind of spin it both ways, and you can kind of emphasize that, because people really want to see that career development bit of the fellowship coming out as a training opportunity as well as a scientific project.
And make sure you really spell out why you feel this is important. That's the vision bit. And then you have the implementation bit. And they want to see you develop.
But I know also your third bit is really innovative. So I think you could make a lot of that this is something that is different, you know, and that will attract that this is exciting. You can't plan what's going to happen because you don't know in 3 years' time where you're going to be and what that data is going to be. But this is where you're hoping your journey is going to take you. And I think that makes it really exciting if you said it.
Yeah, I think this is absolutely fine to have in a fellowship, to have one aim where perhaps you haven't got any prior data and it's more high risk essentially. But also I think, yeah, to think about what you might do if that bit fails as well. So have some backup plan in case that goes completely wrong and the technique falls apart. So if you thought about that, then I think that shows that you've considered all the possibilities of what might go wrong with that particular aim.
Yes, sometimes if everything sounds too safe, it's feasible, sure, but it's incremental. No one wants to fund something that can be described as incremental.
Is there any other questions? I can have a follow-up question, which is kind of related. So one of the key things is creating that niche from your supervisor. But how, maybe the more junior people, how did you do that? And how early do you need to start thinking about that?
I guess I can answer. So I did my PhD with Professor Curran, and then I've stayed in the same institution to do my postdoctoral fellowship. So it is important, and I think one of the things that MRC talks about is those markers of prestige. That means kind of markers that you are starting to establish yourself in this field. So that can be being invited to give talks, that can be publications, that can be being on committees and panels and writing guidelines, depending on what your area is, whether you're clinical or non-clinical. But it's those markers that marking you out as a future research leader, and there can be lots of different things. That's one thing that can help. I think just making sure that it is a really personal vision, your fellowship. And definitely for my pre-doctoral applications, I had quite a few failed PhD fellowship applications. It was only really when I switched to a project, a bit like when that was really my project and what I'd started out wanting to do in the first place, that it suddenly kind of all fell together. So I think that real ownership of it being your idea, your project, which may have started with your PhD work and is a development of that, but showing that you've got this vision of where you see things going and then where you see things kind of folding out from there. That's what.
And even within the same institution, you can move if you're a better fit with a different place. So I moved program within ICH between my NIHR clinical lectureship funding and my clinical trials fellowship. I moved to take up my UKRI Future Leaders Fellowship to PPP because there was a much better alignment with that department than the previous program that I was in ICH. So be able to have that confidence to speak to the people that you need to speak to if it's a better fit for you, just to completely move and then separate yourself and be more of that kind of platform to establish your independence.
I think bringing the separate new collaborators in, which perhaps your your mentor or supervisor hasn't really been involved with, is a good idea. It used to be the sort of dogma that you had to move, and I think that's not fully necessary now. I think you can bear your own niche in the same department, but build additional collaborators and new aspects, new work into your department.
Yeah.
Sorry.
I was going to say, they talk about intellectual mobility as much as physical mobility. I mean, I did both. So I had a welcome personal training fellowship and then a welcome postdoctoral fellowship. And going from my training fellowship was skeletal mechanobiology. And you asked the question, and why I'm answering so to you. Skeletal mechanobiology. And I went from that to neural tube biology. But I was actually studying the same cell signaling pathway that I was interested in my PhD. And I brought a different way of studying a developmental biology question. So that was very much intellectual mobility. The physical mobility was really accidental. I'd happily have stayed in Bristol. It's a beautiful city.
I was going to say as well, that, like, technology means that the world has moved on and it's so much easier to actually collaborate with people on different corners of the globe. I mean, time difference sometimes causes a bit of chaos if you're trying to coordinate meetings between people in Australia and Japan and the US, but in essence, it's so much easier now than it was even 5-10 years ago to have those meetings with people across the globe or in different places. And I collaborate and work with far more people outside ICH than I do within. And I think that technology is a massive part of that.
And then if you want to move or have an opportunity to move, it's not wrong to do so either. I don't think it's a dogma one has to move, and increasingly less so. But you know, new environments provide lots of new opportunities, and they also serve. It's like moving house. It's a sort of internal refresh. You decide on all your old books which ones you want to keep and which ones you want to throw. And if you go to a completely different place, you also try to rescind yourself and think, what do I really want? Where do I really want to go? It's a good process.
I agree. And I think if you do stay in the same institution, you do have to make a case for it. So you do to kind of, because they're one of the pieces of the place, it's important that you make the case that this is the right environment for you, for your development, for your for example, for the patients that you want to see or the collaborators that you do need to be physically close to. So I think you need to make a case for it and explain why it's the right environment. And many of the fellowships will encourage you to have a sabbatical period overseas, which is really valuable and can really help like cement collaborations. So I had one which was supposed to happen in my fellowship, but didn't happen because of COVID, which is now a shame. But they do really like that. And I think it also shows, again, that kind of like international reach and kind of international collaborations. So that can be really valuable. It can be difficult for some people because of lifestyle reasons and kids and things like that, but it can be really valuable and a lot of fun as well. Funders do like it.
Yeah, and ultimately in a larger career trajectory, it gives you another type of evaluation. If you were successful in one environment, is one thing because you had very specific environment and very specific mentors and whatever, maybe you got along with these particularly well, there was a good fit. If you are then successful in a completely different environment, tells anybody looking from outside that you are bringing something to the place that you will implement, and the chances of you providing a similar or comparable effect in a third environment is growing. So it's just completely independent validation.
I think there was maybe a question online as well.
There is. I'll just read it. I'll put it up, but read it out as well from Brit. So most of the time we're searching for grants and trying to fit in with the guidelines of the particular call, competing with everyone else applying. But do you have any advice for working with the funder to build a fellowship application to which you would then apply? We are currently in comms with LifeArc about a translational research fellowship that doesn't yet exist, but I'm unsure how to approach the situation from this angle.
I mean, definitely with the small charities, so the disease-specific charities, it's definitely worth, because they tend to be very small teams, it's definitely worth getting to know the grants advisors or the grants managers and talking to them. And they often have, for example, people making donations for specific kind of research priorities, etc. So that can be very useful. From an NIHR point of view, it is really worth looking at the research design service. I don't know if anybody's used that. So that's more for clinical research. What is for clinical research, but they will help you and tell you directly to which grant stream is useful and work out what you'd be kind of competitive in. So for clinical researchers, that's really useful. I think for the bigger grant bodies, they will be less flexible because they tend to have their priorities set kind of many years in advance. You can still get access to the grants advisors, so both Welcome MRC and now KRI, you can go and speak to them. They do tend to be they will just tell you to apply. So unless you really, really don't meet the criteria, they will just say, oh yes, absolutely, apply. So I applied, I went to see the Welcome advisors and they said, oh yeah, absolutely apply, you're not too soon. Yeah, you'll be really competitive. I just got rejected without, didn't get shortlisted. So
I think what I would add with the big funders is they typically have multiple panels. And it's sometimes your work may bridge more than one panels, and if it ends up with the wrong panel, it's more likely to get rejected. So there's a little bit of gaming the system in terms of knowing how to target your grants to a specific panel. For example, in my work, it sometimes accidentally goes into the neuroscience panels. I'm a cell biologist. That's when you know the work's not going to get funded.
Yeah, and you can also, with whatever grant application, be too much ahead of your time, and that doesn't, that's not well received by funders usually. And then you ask yourself if you are out of frame or if they are out of frame. Doesn't help you much in the reflection, but it can really happen. It also happened in a way in our current BRC application, where with our child health informatics team, what we want to do, the way we want to use real life electronic patient data, the reviewers just didn't understand. Just didn't get it. And then you can make as many words as you want, you will not fully get it across. That's not against what you want to do. It's just, the way that frequently the environment is not entirely ready for the next step. And funding bodies tend to be relatively conservative and can take, a long time. When we started to write the first gene therapy applications, they all said, this is nuts, will never work. It's fine. That should not deter you.
Just a follow-up question, if that is possible. In this case, when you feel like, okay, I submit an application and they say, well, it was not competitive, but yeah, the feeling I got was that they precisely didn't grasp what was the big picture. And then how do you go about it? So do you target a different funding, or you just try to kind of say things in a different way, or maybe submit it not as a fellowship, but as a grant? What would be your
There isn't one answer to this, I think. That's why I emphasize the internal compass so much. You will know what you have to do. Okay? And then maybe you try different ways, and others can also, tell you that there's an opening here or there's another opportunity there. But ultimately, you have to know where you want to go. That's the really important thing. And if you're convinced you want to go there, even if, the grant landscape isn't ready, you should still try to go there.
I think it can be frustrating because often the feedback you get is very, very minimal and very non-specific when you get a rejection. So it can be frustrating. And the problem is that the big grant bodies just won't give you very specific feedback sometimes. If you don't get shortlisted, you don't get reviewed, basically. So I think that's when you need to use whatever peer review you can use, maybe ask a trusted collaborator in the field, something to review it and say, what do you think? And then I think you just have to then, like Thomas says, just look at what opportunities are coming up and think, how does my research fit into those opportunities without diluting the kind of your vision and what you want to do, but just you sometimes just have to adapt and change.
Yeah, so I'm putting in another welcome application next month, and I've had it reviewed by 12 people, including David. Every probably not.
No. Yes, partner.
Every single one of those 12 people gave me completely different comments. And actually finding common threads between them is extremely difficult. No, it's helpful because you need to try and work out who the panel's going to be, and it's trying to work out what they're going to be looking for.
Yeah.
And it frequently shows you things you haven't thought through to the end.
Yeah, absolutely. And improve the science, there's no question.
As well. I think the thing that I found the most shocking about my clinician scientist fellowship application process, I don't know if you found this with yours, Gwyneth, but with your fellowship process, was in the interview how completely non-expert and broad the panel was.
Yes.
So it was difficult because I'm a clinician scientist, so there were clinician scientists on the board, so it's slightly different to the non-clinician process. But one of the main people questioning me for my proposal, which was a stem cell project, was a surgeon from Bristol in a bow tie with a suit who couldn't believe that there were only 4 children in the world with this kind of epilepsy. So you have to really be able to sell the broader kind of relevance of your project for science, for society, for health, and really show its importance to a skeptic who just believes in kind of projects that are about cancer. Because the people that review it, as was pointed out in the presentations, are just, even for like the neuroscience board of MRC or the different boards of MRC, are really from a very broad church. And you will only get 2 people who will review your application fully, and they will then present your application. If you get shortlisted, they will present your proposal to the shortlisting board if you get down to that stage, and it'll be how well they present that and support it. And whoever else is there doesn't probably read it in that much detail. So that's how kind of arbitrary it can be at that stage. So it has to be really punchy and capture people's imaginations very easily, which is an easy thing to say, but it just shows you that you have to think that broad and be make it so readable.
Any other questions, sir?
Is there an importance of like diversifying the charities or funding bodies that you go for? For example, if 2 people are going for the same grant, one's been funded by 3 different panels and one's been funded just by the same grant panel, is one going to be more competitive over the other?
Not necessarily, because some things are always going to be the best. Like NIHR might always be the best fit for a certain type of research project, and similarly MRC might always be the best fit for another. But I don't think there's a straightforward answer to that.
No, I think there's no straightforward answer, and it also depends a bit on what type you are, okay, and where you want to go again. And there are people who certainly at their first fellowship from Wellcome, their second fellowship from Wellcome, end up as Wellcome principal fellow, doesn't exist anymore now, and they're very happy, you know, that they just go with Wellcome because that's a good fit. Perfect. And others find that even the grant giving body landscape is not really tailored to what their needs are, and have to have much more diverse approaches to eventually make things fit and get somewhere.
Yeah, I think something we haven't really talked about is incrementality. There's no point in applying for a £3 million grant in your first round. So sometimes it is easier to apply, say, to a society funder for a £5,000 travelling award, and then for a seed corn award, and then for your own personal fellowship, and then for an, you know, it won't necessarily all go from the same funder. There will be growth in that process.
I think there's one more question online.
One more online. And then last, yeah, we'll have this as the last one. Related to Amy's earlier comment about international sabbaticals and travel collaborations, perhaps Gabe and Thomas might like to input on this as well. Do you know of any systems or programs that support researchers with significant visa restrictions? For example, Brit herself, a South African, not yet settled in the UK and won't be for 4 more years.
I don't specifically. I know there's lots of specific travel fellowship scheme like the Vogue fellowship, which a lot of people from here take up. What's the comment?
Do you know the answer? Sorry.
I would also not have one standard answer because all of these requests come in different flavors and have different upsides and downsides. And we have certainly over the years tried to make ends meet for people from Australia, from South Africa, from India, in all different variations of this, and with a bit variable success also.
Thank you.
Thank you very much. I think that's all the time. Pizzas have arrived. So maybe we'll wrap it up there. We can have discussions over pizza. Which are going to be up on there.
Big thank you to the speakers and panel members.